Welcome to our inset 30 visual product guide. Wash your hands thoroughly before applying the inset 30. These are the recommended infusion sites. Don't use an area right next to your previous place of insertion. Clean the area of insertion with a disinfectant as directed by your healthcare team. Be sure the area is dry before inserting inset 30. Check the tamper-proof seal and sterile paper. Do not use the device if the seal or paper has been broken. Pull the red tape to remove the seal. Pull off the sterile paper. Do not touch the spring. Hold on the lined indentations with one hand and pull the lid off with the other. Caution: be careful not to bend or touch the inset 30 introducer needle. Important note: if the infusion set is not securely placed in the insertion device with the needle pointing straight ahead, pain or minor injury may occur during insertion. Place your fingers on the lined indentations on each side. Pull back the spring softly until you hear a click. The needle protector will lift up or peel off. Do not touch or bend the needle. Immediately before insertion, carefully bend back the needle protector and remove it. This will remove part of the adhesive backing paper. Be sure the tape is not stuck on the introducer needle. Insertion. Place your index finger on the top release button and your thumb on the bottom release button. Position inset 30 with its legs level or flat on the skin to ensure an insertion angle of 30 degrees. Make sure to maintain a 30-degree angle while inserting and gently squeeze once to insert inset 30. Make sure the cannula stays in place. Put your finger gently on the clear window while removing the insertion device and introducer needle. Pull it gently straight back. Secure the cannula with one finger on the clear window. Carefully remove the backing paper under the cannula housing as shown. Remove the backing paper under the front end. Massage the adhesive thoroughly onto the skin. Important: do not attempt to straighten the adhesive if curled. Put the lid back on for disposal. Remove the circular protective cap. Prime the infusion set until medication dispenses from the tip. Ensure there are no air bubbles in the tubing or inset 30. Consult your pump manufacturer's instructions for use for proper priming procedures. Place a finger in front of the cannula housing and insert the connector needle. Make sure the connector locks with a click. Fill the empty space in the cannula with the following prime. Disconnecting. Inset 30 allows you to temporarily disconnect your pump without having to change the infusion set. Place a finger just in front of the cannula housing and gently squeeze the sides of the inset 30. Pull the connector needle straight out. Cover the connector needle with the circular protective cap. Insert the disconnect cover onto the cannula housing until you hear a click. Reconnecting. Remove the circular protective cap. Prime the infusion set until medication dispenses from the needle. Caution: when priming, hold inset 30 with the needle pointing down. Remove the disconnect cover from the cannula housing. Place a finger in front of the cannula housing. Push the connector needle straight in until you hear a click. You have now completed the visual guide for inset 30.